films that I looked at was a lumbar spine MRI scan, cervical MRI scan, and then the plain X-rays of the cervical and lumbar spine. Okay, cervical MRI scan where you've had the surgery. The surgical level looks great. Okay, at that level, everything looks fine. But once again, level above and below where there are changes that are going on that are still present, and I think we had discussed them before. Back in January when you were here last.
Yeah.
So that's the main thing with the cervical MRI scan. Some changes at the.
So that's going to continue just to.
It may certainly continue. Yeah. I mean, there's a possibility it may stop at some point, but the stresses are, of course, at the level above and below the fusion, and that changes can continue. It could be.
There's nothing you can really do about that except fuse it at some point.
Yeah, that's right. Okay.
So I'll just wait until I can't take it anymore, and then we'll talk about it.
Yep, we can do that. So that's the neck. In the lumbar spine, the brunt of the problem is at L5S1.
Right.
Okay, the disc space is basically collapsed.
Right.
There's a disc that's protruding outwards, bulging backwards, of course, and that's because the disc space is collapsed and the disc is sort of bulging in the backwards direction.
What about the nerves that come out the sides?
The nerves that come out from the side, to me, they look like they're going out without any difficulty, but on the other hand, if you can, when the spine sort of
when the disc collapses, doesn't it squeeze?
It squeezes off the holes to which the nerves come out from.
Right, that's the model right there. These are the holes right here.
Exactly. And so if you imagine this sort of collapse,
and squeezing it down right there.
So that's what that's been. I mean, on the MRI scan, you don't.
The central isn't really the problem. It's the side that's worse than the
Well, there's two things that are at issue here. One is the fact that the disc is markedly degenerated. I'm talking about.
I can see it bone on bone.
Yeah.
Just about.
And that in itself is a painful situation because because of that the spine is not able to support its weight because the disc is collapsed and not functioning normally, and that can cause mechanical low back pain. And then as this collapses, you're correct in pointing out that the space narrows like this. And when the space narrows, the hole to which the nerves are going out from, they can get irritated, although there's no obvious disc compressing it. But on the other hand, they are getting less space to go out from. The disc protrusion is in the middle. You're right.
And there's not a spinal cord there, so
there's
it may not be even touching anything.
Spinal cord is up here, all the way down here is just a sac of spinal fluid which all the nerves are going through. So the disc is actually coming out in the middle. And that's basically coming out of the middle. It's like a toast and jelly. You compress the toast, the jelly is going to go somewhere. And that's what is going on. So that's the issue. And at L4-5, the level above this, shows early signs of degeneration. Not as bad, of course, as this one, but some early signs of wear and tear at that level.
So what? And I had another doctor I went and saw a couple weeks ago. His name's Dr. Patterson, up in Harrisburg. He's a young doctor. He was involved with the trials that the FDA was doing. He was doing
the disc for the scale?
For the project. And he told me that I had advanced facet joint arthritis.
Yeah, I mean, there is some facet arthritis.
And he said that the surgery wasn't going to help me and that he wouldn't recommend it.
See it, but you can see that the joints are larger than usual, or something is not completely normal about them. Yes, you do have some facet arthropathy, which is what we call.
That's because the disc is collapsed.
Yeah, because the disc is collapsed.
It's stressing them out.
It's exactly right, and but
it doesn't preclude me from having surgery.
No, it doesn't. But I can tell you, it lessens the chances of success from an artificial disc.
So it's not going to hurt.
Your L5S1 is basically at end stage at this point. I mean,
it can't get no worse.
I mean, it couldn't get any worse, right? This end stage, I mean, the disc is almost completely collapsed.
Outpatients, they only pay, you got to be in. I
talking about Blue Cross?
Blue Cross just stopped me with, I had Dr. Eric Walsh, that's my pain management doctor.
Well, I mean,
they stopped me with, I had 2 steroid injections, and it was an outpatient thing.
Oh, okay. Well, let me just tell you, the surgical part of the procedure, the surgical fees for a single level minimally invasive posterior fusion will be about $20,000.
That's not bad.
Okay? Hospital stay, most likely they will go home
One day,
Yeah.
one day. So at least it'll be inpatient, like
Right.
last time.
Right, if the inpatient, you will go home, let's say the next day, I mean, you're looking at, the cost is going to be on the instrumentation, on the tools that are used, on the screws and the rods and so forth. Given all that, I mean, I'm thinking that the hospital cost will be about $50,000-$60,000.
On top of the 20?
Yeah.
So it'll be 70.
Yep.
About 70 total. That's what they did last time. I paid you